You're recording. Good job.
We are on, and ladies and gentlemen, this is the Heywood Healthbeat. I'm Mike Ellis, your host, and today we're joined by President and CEO of Heywood Healthcare, Wynn Brown, for our annual discussion about all that's going on in healthcare in and around the Gardner area, around the state and the country. Wynn, thank you for joining me.
Yeah, thanks for having me on board during, I guess this would be our holiday edition since it's festive attire wear today at Hayward Healthcare.
Just comment on your suit. It looks great. Ladies and gentlemen, this recording is being produced during the holiday season. Although you may see it after Christmas, Wynn still spreads the holiday cheer throughout the year at Hayward Hospital.
Well, there's a bunch of us. We got a good Groupon buy, so there's a bunch of us who have bought some really snazzy suits that have a very limited time of year to wear.
Yep, so you have to get your money's worth and wear it every day for the next week.
I think I only have to wear it once to get my money's worth.
No, that looks pretty good. That looks pretty good. Well, let's talk about some things that are happening in Gardner in particular, nationwide, but what's happening and how it's affecting the Gardner population in Gardner Hospital. The big issue right now on everybody's mind is COVID-19. You put out a weekly update for the community, which is awesome. It's great information. It gives the stats and statistics of what's happening in Hayward Hospital with regards to the number of cases. Give us a general synopsis today. What does COVID-19 look like at Hayward Hospital?
So today, which is mid-December 2020, just in case this has a long shelf life to it, if you see from my updates, which we now do 3 times a week, just because the pandemic has definitely surged, and it's what we would really see as the second surge. So I'm reporting 3 times a week. I'm sharing primarily, the first thing I always share is what's our testing status. What is our positivity rate, both cumulatively and then on a 7-day rolling average, which is a much better snapshot because it's more real time and lets you see what's going on. And our positivity rate is through the roof, in not only in Gardner, but in a number of the communities in the region we serve. And so that is a huge concern for us. We saw our positivity rate increase as the rest of Massachusetts was increasing, especially toward the urban areas. But we didn't initially see the big uptick in inpatient volume. And as you know, Mike, a lot of people that have been testing positive have been asymptomatic in this second surge. And so we did not initially see a big push on our inpatient volume. Today, our inpatient volume is essentially just about as high as it's ever been. But we definitely have better access to testing that we didn't have originally. When this pandemic first hit, it could take 3, 4, 5+ days to get test results back. Now we have rapids on site. So when someone's being admitted from the ER, we know definitively as you can. There's always a margin of error if someone is positive or not. We always test those rapids against our in-house PCR testing. So we run a PCR test overnight as well, just to confirm. And we've batted almost 1,000 on that. So where you hear a lot about rapids out there, those are antigen rapids, and where there's a much lower sensitivity, ours seem to be doing very well. We use the Abbott Alere 2. And so we know on our inpatients upon admission fairly definitively if they are COVID positive or not. So we've seen a big uptick, and we're not seeing a much of a decline yet. And this seems to be the after Thanksgiving surge that everybody was expecting. I think a lot of people have returned home as schools have closed, colleges have closed, more home learning. Temperatures are colder, so more people are gathering inside, and I think we're all fatigued by this pandemic. And so it's easy to let your guard down by not wearing a mask, not maybe doing as good a hand hygiene as you could be, and clearly not social distancing. And so those things are definitely putting pressure on our system. I think Dan French, who runs our labs, told me that in November alone, we conducted at Haywood over 6,600 COVID-19 tests.
Wow.
Just at Haywood. And we have testing available 7 days a week now in the Damon Pod building across the street. The testing's now done indoors because it's just too cold to run it outside via our trailer and tent. But we're not seeing any decline in the demand, actually an increase in demand for the testing.
I was going to ask you, what are you seeing in terms of trends? And you just brought it up, four major factors that are affecting the positivity rate and the both symptomatic and asymptomatic positivity rates. Fatigue, certainly there's pandemic fatigue. People are letting their guard down. Mask wearing, hand washing, and social distancing. Four very important messages
Right.
that I think, and I think you would agree, we're going to continue to have to do well into next year.
Oh, absolutely. I mean, the overall population won't have full access to the vaccine until probably early summer. Obviously, this starting tomorrow, we will begin vaccinating our staff. But again, our first initial shipment is 675 of the COVID-19 vaccines from Pfizer. We are an organization. If you include our independent medical staff and affiliate, we're about 2,000 when you get right down to the numbers that we need to vaccinate. And a large number of those are frontline care providers. But it's going to happen in phases for us as well. And then the community, and I had a nice conversation with Mayor Mike Nicholson earlier this week to go over their vaccine plans when it becomes available more to the general public and to the folks that are not clinical providers. And their plans in the city to do that, of course, which we will support them in that effort as well. So we're going to go live with it starting tomorrow, but we are at the mercy also of the federal government's distribution plan. So we do not know when our second shipment is slated to come. So we are, and the other piece is, not everybody at this point in time seems to be comfortable with taking the vaccine. And, in talking with Dr. Mahan, who is our infectious disease chief here, everybody talks about herd immunity. When do we get to the point of herd immunity? And you listen to Dr. Fauci, we need to get up probably over 65, 70% of the population before we start seeing some of that. When you look at polio, I believe you have to have 80% vaccination rate for that level of immunity in a community. And I think measles is 95%. So, this disease, we definitely need a large percentage of our population to get vaccinated.
Yeah, and it's a huge undertaking. Thank you for sharing that with us. From a Heywood Hospital perspective, what worries you most about COVID, and what are the opportunities that Haywood's facing as a result of COVID?
So I think, obviously our ability to remain a full service organization in the midst of the pandemic so that we can continue to serve our patients. Obviously, we have ramped up and have telemedicine available through all our practices if someone does not feel comfortable coming in. We have also been very strategic at the very beginning of the pandemic to really direct patients who are sick or not feeling well to our 2 urgent cares, where they could be evaluated and tested at tele walk-in care and Haywood urgent care. So that allowed our practices, both those part of Haywood Medical Group and our independent practices, to continue to do their preventive care, the annual physicals, vaccines that need to be for pediatrics, all the things that you would want to be following up on in the practices and do our best to shield them from the virus, especially early on in the pandemic. So that has worked out particularly well for us. And the fact that we are, for more than most hospitals in New England, have 7-day-a-week access, regardless of symptoms. So we have drive-through, and now at the Damon Pod, we have a standing physician order. You make your appointment, so we don't have long lines like you see in other places. You have an appointment slot. It takes just a few minutes, and then you're on your way. And then we follow up and charge the insurance after that. So regardless of ability to pay, we test people.
Yeah, it's a remarkable system that Haywood's been using. I have accessed it myself and just found it so easy, so non-intrusive, convenient. So folks, give that a thought. If you are needing a COVID test, Haywood Hospital has the
right. And we have so many barriers to care and healthy lifestyles and everything in our region that, given our socioeconomics, that we felt that we had to make it a very low barrier to entry if you wanted to be tested for COVID-19. And so that's what we have done. Other areas you have to pay up front, and and probably not get your insurance charged. And that's not the way we've operated. We've also made sure that any of our staff and their families who want to be tested will be tested. We will waive any copay or deductible that might come up, just to make sure that our staff have access to testing.
Yeah, it's awesome. You know, you mentioned in your discussion about your response to COVID, ramping up telehealth services. Let me just qualify this for a minute. Heywood Hospital has been a leader in promoting telehealth services for many years prior to the pandemic, really out front talking about the need for people to have access to care, virtually, and not necessarily have to make in-person meetings. So I give you great credit for that, and it really set up Heywood Hospital for success.
Correct.
In implementing telehealth. So tell us a little bit about your telehealth services. What does that mean for people who haven't been? And I can't imagine there are a lot of people that haven't been, but for those who haven't been using telehealth services, what's different?
So, well, what's different? What's not different is on the behavioral health side, especially for our high school age teens and adolescents who need behavioral health services, counseling services. You know, we have been providing that in a number of the school systems virtually for a number of years, largely through grant support. And you're right, Mike, we are considered by Massachusetts as truly the leader in that genre of telemedicine. And we have been able to continue supporting those high school and junior high age students throughout the pandemic. So that we have been able to keep their access available, and that service has really not skipped a beat per se on that. What is different really is that all of our practices now, whether it's primary care or specialty care, you can call, make your appointment, and have it set up as a telehealth visit. And so that access is now across the system when it comes to primary and specialty care, which was not as easily accessible prior to the pandemic. So that is if there's, talk about silver linings of the pandemic, that is one of the silver linings is that telemedicine has definitely come into its own in Massachusetts. The challenge that remains, however, is while it's supported by the governor's orders during the pandemic, the Massachusetts legislature still has not passed the law that is model legislation to require that all payers pay for telemedicine at a parity level. Over 40 other states have already passed telemedicine legislation, and Massachusetts has yet to do it in a comprehensive fashion, which is disappointing. Our local delegation has been incredibly supportive of it, but we need everybody on Beacon Hill to come behind it and make sure that the model legislation we put forward is passed, hopefully in the upcoming session.
A very important message, a huge message for our viewers out there. There's legislation, there are other things happening at both the state and federal level that impact healthcare, and one of those is the telehealth medicine bill. So we applaud our local contingency of representatives and senators for supporting that measure.
And they have been incredibly supportive. So they're definitely carrying the flag on this.
Yeah, that's great to hear. You mentioned the practice groups, that telehealth is being implemented in practice groups. There's been a lot of expansion of services in practice groups at Hayward Hospital. Tell us about some of the new services that have come on board and some that are expected to come on board maybe in the next year.
We just last week, we opened a new outpatient behavioral health office under Haywood Medical Group. And we have an adult psychiatrist, a child and adolescent psychiatrist, and an advanced practice provider, NP, who is also specializes in behavioral health. So that provides a whole new level of access for patients who need that level of care in the community. It's for those who try to access in-person services, especially after a discharge from an inpatient facility and that necessary follow-up, it's very hard to get that. And now we have that, and that's actually in the annex building where Mike, your office is located. I think you had to move to make room for them, but we needed them on our campus. So my old offices, old HR offices are now been transformed into that. Eventually, we do want to move them into a newer location, but we just are a little constricted on site right now. We also have a brand new neurologist on our team, a new endocrinologist. We have a new urologist joining us in the spring. We've been very successful in building our GI practice for endoscopy services, gastroenterology. And out in Athol, we have more and more specialists rotating to the new Athol Medical Building, along with Athol Primary Care being there as well. So a lot of new physicians joining our community and making sure that we have a breadth of services. Very challenging given our size population to have a full cadre of specialists, because you need so many people in your service area to support different specialties. And so we have some other ones that we're recruiting for as well. We have a new general surgeon that just signed with us as well, who will be with us next year. What we are finding, one of the things that we have been building on over a period of time, and the pandemic, actually, another silver lining of this is there are a number of very seasoned medically trained and practicing specialists in New England who are looking to move to a more rural location and get out of the city in the academic setting and then practice real community-based healthcare. So that has been a blessing to us as we become more attractive. The other piece is it takes some folks some understanding, but we are not that far outside of Worcester or of Boston when you get right down to drive time and accessibility. The Route 2, I-90. We are well positioned. I like to say that we may be psychologically far away for some people, but we're not that far away. No. And so, and with telemedicine and the ability to flex between telemedicine and inpatient care, it gives providers some new level of flexibility as well in how they practice medicine. So you might be a specialist who practices a day a week from home doing your telemedicine work solely on a particular day, or you might be someone in a practice who sees a patient and then sees a telemedicine, depends on your practice style. But we've been very successful, and we have just incredible medical staff. At Haywood and Athol, one of the things that is lost in larger settings is the collegiality of a medical staff, especially with the advent of hospitalists and no longer really doing inpatient care that connects you day to day to the hospital. We have a very collegial, connected, respectful medical staff that enjoys each other's company, enjoys the practice of medicine, picks up the phone and returns each other's calls when they want to consult. And so that is very attractive to physicians who are looking for a place where they want to practice medicine for the long haul.
Yeah, in Haywood, for those of us that have had some kind of experience with Hayward Hospital, is just a great community hospital setting. Right. It's a success story for sure. You talked a lot about the expansion of our practice groups and specialty care. That obviously means that we need to do some physical plant construction. What are some of the capital expansion projects that Hayward Hospital has going on, and what's coming up for the future?
Right. Well, maybe I'll just start off campus from Hayward Hospital. We are building out a new primary care practice in downtown Orange in the old TD Bank building, and so that'll be Millers River Primary Care. We'll be moving there early into next year. We are going to be opening a new primary care practice, 2 new primary care practices in Gardner, one of which will be a relocation of one of our physicians next to our physical therapy and rehab down on Pearson Boulevard. And so we're going to be expanding our primary care footprint in our region as well to better serve our patients. At Haywood, we have 2 major projects, one underway and one on the books. Underway, we have a major energy infrastructure, sort of behind the curtain project, which is almost a $20 million project to upgrade our power plant, our emergency power, and how we distribute that throughout our facility. All our HVAC will be upgraded. So think of more efficient boilers, more efficient air conditioning units. We're going to have a cogeneration plant and a battery backup system, which essentially will allow us to you and I have heard the term, and others have heard the term, islanding. So if everything goes to heck in a handbasket and there's no power anywhere available where we would typically be on generator, we have the ability through our resiliency of solar, battery, and propane, natural gas, to island and fully run Heywood Hospital's campus with nary a blip in how we operate. And that is just incredible. And as folks who have lived in the Gardner area for a long time, a lot of our infrastructure is much older. Our buildings date back to 1907. That doesn't mean we haven't invested and upgraded, but this is a comprehensive campus-wide upgrade to all of our energy infrastructure. The second project on our books is to build a new surgery center on our campus off our south entrance. We've been working with the city and city council to work. We have two things that need to happen, and we've been seeking the city's support to make sure that we remain a strong and vibrant community hospital that's independently owned by rebuilding and building new ORs. Our OR operating rooms were designed and built in the 1960s. They are small, they are at capacity. If we're going to continue to provide high level of surgical care here and attract really early and mid-career surgeons to our region, we need to have those new bigger ORs. And so the city has a request before them to remove a couple of restrictions on some of the land that we purchased from them in the 1990s, and also to lease us a small parcel of land off our south entrance to make sure that we have the space we need to expand. It is very challenging at Haywood. We live on the edge of Crystal Lake and are bordered by Green Street. We live on this tight crescent of land, some of which we own, some of which the city owns and has leased to us in a long-term lease, and we're looking for a little bit of additional land. We've done incredible work with our engineers to make sure that what we are proposing has no impact on the watershed, because everybody, including us, because we drink the water from Crystal Lake as well, we got some engineering strategies that we would build in place that would really have what we believe no impact on the Crystal Lake from a drainage perspective, from parking lots and those kinds of things. If I had some pictures, I could show you how that all works, but we've done a lot of work with our civil engineers, and we feel very confident that concern, which I think is the primary concern of the city, is to make sure that we're a good steward. And I think we've shown that we are and can be that.
Yeah, how wicked exciting is that? The upgrade of the existing kind of older facility, that comprehensive energy upgrade, and the new surgical wing. Two very important projects for people to keep in mind, because if you're not expanding, if you're not growing services, then you're going to become obsolete.
Right. Well, and if you think about a hospital has a major engine room, and that major engine room is its operating rooms. Those drive, along with radiology and your emergency departments, those drive your organization. We have a beautiful ER at Haywood that we put in now 10 years ago. I think it opened 10 years ago this week.
Wow.
And so we're in good shape there. Our inpatient, other than our mental health unit, which we still need to figure that out, we have beautiful inpatient space. We have renovated and upgraded our facility. I'll put Haywood and Athol Hospital up against just about any community hospital in northern New England as really premier facilities. And so this is one of the very last major things we need to do to really be relevant in healthcare as we look to the future and operating as an acute care hospital in a region. And given the size of our communities, it's a rarity and really a gem for a community the size of Gardner and a region the size of North Central Mass to have a hospital like Haywood in its midst. And we are the largest employer. We drive a lot of the economy, and our health goes, so goes the region, I guess I would say.
As the largest employer, for sure, in the Gardner area, and being such a long-standing employer, what are some of the challenges you're facing as an employer?
One of the challenges that we are facing is recruitment of certain key clinical and technical staff. So, to be competitive in the marketplace for certain different folks, that doesn't sound very technical, but there are radiology specialists, there are lab specialists, there are respiratory specialists, people in psychiatry. And there are some certain little niches of certain job categories that are a challenge for us. We've worked very hard on making sure that our pay and compensation is competitive in the market. And, As you are aware, we just announced across the board increase in January 1, which will mean we've given a 5.5% increase in pay to all our non-union staff in just 6 months. We're doubling our retirement contribution, doing an earned time buyout to help support staff. So we're doing a lot of things in that area to make sure that we are competitive. The challenge for us in being competitive is we now compete with Boston, just like we compete for physicians. We compete all the way to Boston, down to Springfield, to Worcester for the same staff. And so in the old days, there was this differential in pay between the community hospitals and the more urban hospitals, and that gap has really narrowed. And, you know, our payer mix, you know, the percentage of people who come here who are on commercial insurance is much smaller than the hospitals to the east. And so, you know, we live on a very thin financial margin. We've been incredibly successful, but we really only have a 1 or 2% margin. And so, you know, at the end of the day, we earn $1 and we keep 2 cents. That's a very thin margin. And so, you know, we have to balance a lot of different priorities to make sure that we can provide the services we can and recruit and retain the staff that we need.
Yeah, Hayward Hospital certainly is a much more attractive place for clinical staff, because you're right, clinical staff could have found very significant differences before, but that's not the case anymore. And it's certainly a very competitive and I think a great place to work. It's just a pleasant environment. They're good people. And we've implemented some customer service initiatives at Hayward Hospital to make that patient experience better. Can you talk about patient experience and how we're really trying to, you know, increase satisfaction and increase the service that we provide?
Yeah, so I would say there's 3 main strategies that we have across all of Heywood Healthcare around patient satisfaction and patient engagement. One is we have adopted a model and a best practice from the Cleveland Clinic, which is a worldwide healthcare organization based primarily out of Cleveland and has some of the highest patient satisfaction in the country. And we have adopted their Communicate with Heart methodology and training for staff. And we have trained all our staff and all staff who join us. They're actually trained by fellow staff members. So, and Mike is one of them, where we have done a train the trainer model so that when you come and you have orientation, it's actually one of your colleagues, not someone who is specific job it is to do customer service training. It's someone who you're going to work side by side with, helping you understand our culture. We also have patient experience teams across all our campuses that are also working on improving the patient experience. And then I have a President's Advisory Council that advises me. This is frontline staff, informal leaders in our organization around things that we can do to improve staff and patient engagement. And we have what's called Tiger Teams, and each of those Tiger Teams now has a senior leader champion to usher forward projects that they that they think we should be working on to improve the experience for everyone in Haywood, whether you work here or you seek your care here.
How cool is that? I mean,
Yeah.
It really just speaks to the philosophy of wanting to make this a great experience for folks.
Yeah.
So,
and it's hard, you know, you know, not everybody walking through our door is arriving in the best frame of mind. If you are arriving in an emergency situation, or you're coming to see a loved one who is in our ICU, you know, I always say that the only people that are excited to come to the hospital are those that are coming to see their new grandbabies, pre-pandemic, of course. And so we have to make sure that our staff has that empathy and compassion built into them and knowledge base to understand that we need to meet people where they are when they come here and make sure that we are providing the highest level of service we can, often in very tense, critical situations. And we need to make sure that we treat everybody individually because it's challenging in healthcare. You can get what's called compassion fatigue. I've seen this, you know, sore throat before. But we have to remember that this is an individual. This is their situation, their concern, and we have to meet them where they are. And I think if you look at our staff engagement and our patient engagement scores, they have actually gone up dramatically, including in our medical practice, which scores very high on a national level as well.
Yeah, that doesn't surprise me. It really, I've seen just an increase in awareness of how we react to and interact with people. So that's been a huge accomplishment for Hayward Hospital.
And I think I do want to just say, I think I personally anecdotally see the community responding, and I think the pandemic has made the community or helped the community at large be appreciative of the services we provide, whether it's in a medical practice, in the ER, on an inpatient unit, outpatient testing. I have never before received so many handwritten notes from staff, from patients who just want to say thank you for their care. They call out some of the caregivers that they had. We share those letters with the units and the staff that are named, just so that they know that the community is appreciative, and you know that a simple written note means more to someone on our team than, you know, getting $100 in the mail. I mean, it really does affect them. I will also say that our giving, the annual giving from the community to the hospital has skyrocketed as well. And so the community has risen up around us, from PPE to just words of support. It's really been amazing.
Isn't that cool? Just as cool. In having interactions with patients at the front door and engaging with them, you really see that level of appreciation, of real appreciation for the work that our staff does at Hayward Hospital. So let's talk generally now. What are some trends in healthcare that that you think are coming, or what might be some important changes in the next year at the federal, state, or local level? One of the things you mentioned earlier was the telehealth bill on the state level.
Well, I do foresee telehealth moving forward, hopefully in the way it's been proposed to the state of Massachusetts, which will just improve access. As you know, if you look at the social determinants of health, one of the biggest challenges that keep people from being healthy and accessing healthcare is transportation, and lack of transportation, and lack of a public comprehensive. We have pieces, obviously we have MART and we have things like that, but we have a lot of rural areas that do not have public transportation. And so telemedicine and telemonitoring at home definitely are seeing their day in the sun. And we need those services to keep happening so that we can keep especially our fragile elders at home versus coming to our ER or having, you know, unplanned inpatient stay. So I do see that happening. The other thing I have seen is this incredible cooperation in the Commonwealth between the governor's office, the Department of Public Health, and the hospitals. And I think historically we have been, and I don't want to say we've been at odds over in time period, but I think they always feel like the hospitals want something, right, or need something. And now we have come together and demonstrated our value, our responsiveness to the public health things that need to be done. And it is a very collegial, team-oriented, process at how do we tackle this pandemic. And that to me has just been amazing. And an unexpected outcome of the pandemic is having everybody on the same page. I think also in the hospitals in particular, and the practices, the teamwork that's been happening, especially this is an incredibly stressful time for all of our staff, whether you are a frontline care provider working in urgent care or in the ER or up on Watkins 1 dealing with COVID positive patients. There's stress throughout the system. And we've done a lot to try to support our staff from, we provided months of free meals to take some of that pressure off. We're in our 12 days of Christmas now with all sorts of good things, including free meals and raffles and dress up days and some things to, try to keep the humanity in our work and support our staff. And we're going to continue to do more and more of that to make sure that that we don't burn out. And people are burning out. I mean, if you are a nurse dealing with a COVID, caring for a COVID positive patient, you have to don and doff every time you enter that room. It is not only is it exhausting, it's hot. It takes a lot out of our staff who are caring for patients at the bedside, and then you throw in ICU patients who are ventilated. and who are, really, on the edge of whether they will survive or not. That is an incredible amount of pressure. And I just salute our staff for all the work that they're doing. I do think it's showing us that modern medicine is incredible. If you think about the turnaround time for the vaccine, I mean, that under a year to develop a vaccine is incredible. And I think that is going to herald a whole new role, future of how fast things can come to the market, that might limit your inpatient stay, allow you to get cared for in an outpatient setting from a pharmacological point of view, from a device point of view, from a location point of view. I think that, this is kind of like going to the moon, right? I was alive when we went to the moon, let me just say, but I was very, very young. But if you look at, all the work that NASA did to prepare to get us to the moon, all the technologies that rolled out of that, from like the basic handheld calculator that came out of the space program. There are so many personal computers, like all those things came out of that. And I think out of this pandemic, you're going to see a new wave of ingenuity and design and technology that we can't see yet, but the innovation is going to come out of this dark day. And I think out of darkness, a lot of the light comes, right? So I think out of this dark time that we are all, marshaling everything we can to get through, wearing a mask most of the day. I think there's going to be great things that come on the other side of it, though we had to go through a very painful period of time.
Yeah, just great points, great perspective, and good information for our viewers out there. Folks, if you want more information about Heywood Hospital, please visit the website, www.haywood.org. Lots of information, including COVID updates on that webpage. You have been with, and we have been with, Wynn Brown, President and CEO of Heywood Healthcare. Wynn, thank you for taking the time today to be with me here on Heywood Healthbeat, and for all the great information you provided. We appreciate it.
Well, thank you, Mike. I appreciate everything you do to support the community as well in your role at Heywood Healthcare, which is just incredibly important, and to everybody in the Haywood family for what we're doing to care for the community at this point in time. It is amazing, and I'm very grateful.
Well, folks, that's it for this edition. Please join us again for the Heywood Healthbeat.